One of my patients called me last month. He told me his chronic prostatitis pain disappeared after changing his bathroom routine. No new medication, no procedures, just 5 simple adjustments I'm about to show you. His case is not unique. Here's what actually works. I'm Dr. Max, urologist for 15 years, and I've noticed something interesting in my practice. Men who make specific changes to their daily bathroom habits see faster improvement in prostate symptoms than men who only take medication. The 5 adjustments I'm covering today reduce inflammation, improve urine flow, and decrease pelvic pain. Most men notice changes within 2 weeks, some even sooner. But here's what you need to understand first. Your bathroom routine affects your prostate in ways most doctors never mention. The temperature of your shower, how you stand when you urinate, even the timing of these activities throughout your day. All of this impacts prostate inflammation and symptom severity. Before we get to the 5 specific changes, I need to explain why your bathroom habits matter so much for prostate health. This will make sense of everything that follows. Your prostate sits at the base of your bladder, surrounded by a network of muscles, nerves, and blood vessels. Everything you do in the bathroom affects this entire area. Not just your prostate, the pelvic floor muscles, the blood flow, the inflammation levels. Here's what research from Stanford shows. When pelvic floor muscles stay chronically tense, inflammation increases in surrounding tissues, including your prostate. This creates a cycle. Tension leads to inflammation. Inflammation causes pain. Pain creates more tension. Your bathroom habits either break this cycle or reinforce it. The temperature of your shower affects blood vessel dilation in your pelvic region. How you stand when you urinate changes pressure distribution across your pelvic floor. Even the time of day you do these activities impacts hormone levels that control inflammation. A Johns Hopkins study tracked 600 men with chronic prostatitis for 16 weeks. The men who modified specific daily habits showed 68% symptom reduction. The control group using only medication showed 31% reduction. The difference was significant. Small adjustments create compound effects. One change improves blood flow. Better blood flow reduces inflammation. Lower inflammation decreases pain and urinary symptoms. Everything connects. But here's what matters most. One bathroom habit stands out as the biggest contributor to prostate inflammation. Most men do this every single day without realizing the damage. I'm covering this first because correcting it creates the foundation for everything else. Hot showers directly before urination. This is mistake number 5. And it affects blood flow to your entire pelvic region in ways most men never consider. Look, I've been treating prostate conditions for 15 years. And one pattern shows up constantly. Men come in complaining about weak morning stream, difficulty starting, that feeling of incomplete emptying. When I ask about their routine, almost everyone says the same thing. Hot shower first, then try to urinate. Here's what happens. Hot water causes vasodilation. Your blood vessels expand to cool your body down. This includes vessels around your prostate and bladder. Your pelvic floor muscles relax significantly. That sounds like a good thing. But here's the problem. Your pelvic floor needs some tension to function properly. Too much relaxation creates incomplete bladder emptying. When you step out of a hot shower and immediately try to urinate, you're working against completely relaxed muscles. The bladder doesn't empty fully. Residual urine stays behind. This increases infection risk and puts constant pressure on your prostate. Over time, this pattern contributes to chronic inflammation. The solution is simple. Take your shower after you urinate in the morning, not before. This one adjustment allows your pelvic floor to work at normal tension. Multiple patients in my practice report stronger flow and better emptying within 3 to 5 days of making this switch. Now here's where this connects to mistake number 4. Because what you do during urination matters just as much as when you do it. And most men are making this next mistake without realizing it. Mistake number 4 is forcing or rushing your urination. I see this constantly in my practice. Men stand at the toilet, push to get the stream started, then push again to finish faster. This creates unnecessary pressure on your pelvic floor and prostate. Here's what happens when you push. You activate your abdominal muscles. This increases intra-abdominal pressure. That pressure transfers directly to your bladder and prostate. Over time, chronic pushing weakens pelvic floor coordination and increases inflammation around the prostate. Your bladder is designed to empty naturally through relaxation, not force. When you push, you're working against the natural mechanism. This leaves residual urine behind. That incomplete emptying means you'll need to urinate again sooner. And you're putting extra strain on an already irritated prostate. The solution requires patience. Stand at the toilet. Take a deep breath. Let your pelvic floor relax completely. Wait for the stream to start naturally. Don't push. Let gravity and bladder pressure do the work. When you're finished, wait 5 seconds. Often a second small stream will release. This ensures complete emptying. Most men notice stronger flow and less frequent urination within 1 week of stopping this habit. Your pelvic floor needs that recovery time. Now mistake number 3. Cold water before bed. Look, I know the advice is everywhere. Drink water before sleep to stay hydrated. But here's what that actually does to your prostate. Your bladder fills up during the night. You wake up at 2 in the morning needing to urinate, then again at 4. This constant filling and emptying pattern puts stress on your pelvic floor muscles throughout the night. They never get proper rest. Instead, finish your water intake 2 hours before bed. Your body processes that fluid. Your bladder empties before you sleep. Your pelvic floor gets 6 to 8 hours of uninterrupted recovery time. This one change reduces nighttime urination significantly for most men. Now mistake number 2. Prolonged sitting on the toilet. I see this pattern constantly. Men sit down with their phone, scroll through messages, read articles. 10 minutes pass. 15 minutes. Here's what that does to your pelvic floor and prostate. When you sit on a toilet, gravity pulls your pelvic organs downward. The toilet seat creates pressure on your perineum. That's the area between your scrotum and anus. This pressure restricts blood flow to your prostate. Extended sitting increases this pressure continuously. Over time, chronic restriction contributes to inflammation and congestion in the prostate. Your body is designed to empty the bladder efficiently within 2 to 3 minutes maximum. Sitting longer provides no benefit. It only creates problems. The solution is straightforward. Use the bathroom for its purpose only. No phone. No reading material. Sit down, relax, empty your bladder, stand up. The entire process should take under 3 minutes. Your prostate needs proper blood flow, not constant compression. And now mistake number 1. The biggest mistake men make. Delaying urination when your body signals you need to go. Look, I understand. You're in a meeting. You're driving. You're busy. But here's what happens when you regularly ignore your bladder signals. Your bladder stretches beyond its normal capacity. This overstretching weakens the bladder wall muscle over time. Weak bladder muscles mean incomplete emptying. Residual urine sits in your bladder. That creates the perfect environment for bacterial growth and bladder infections. And constant pressure from an overfull bladder pushes directly against your prostate, increasing inflammation. When your body tells you it's time to urinate, listen. Go within 10 to 15 minutes of feeling that first signal. This simple habit prevents bladder overdistension and reduces prostate stress significantly. But knowing these 5 mistakes is only half the solution, because implementation matters just as much as knowledge. Let me show you exactly how to put all of this together into a daily routine that actually works. Here's your morning sequence. Wake up. Urinate first, before anything else. Don't push. Relax and let it flow naturally. Wait 5 seconds after you finish. Then take your shower. The hot water relaxes your muscles after your bladder is already empty. This eliminates morning retention. Throughout your day, listen to your bladder signals. When you feel the urge to urinate, go within 10 to 15 minutes. No delaying. No holding it for hours. And when you're in the bathroom, leave your phone outside. 2 to 3 minutes maximum. No prolonged sitting. Your evening routine matters just as much. Stop drinking water 2 hours before bed. Use the bathroom one final time right before you sleep. This gives your pelvic floor uninterrupted recovery time throughout the night. Most men following this protocol notice changes within 1 week. Stronger flow, less frequent urination, better sleep. Within 2 weeks, Inflammation starts decreasing significantly. Your prostate needs consistency. Stick with these adjustments for 30 days minimum. Now here's what I need you to understand about taking action on this information. Start today, not tomorrow, not next week. Today, pick one mistake from this list. Just one. Make that single adjustment to your routine right now. Tomorrow, add another. By the end of this week, you'll have all 5 corrections in place. Knowledge without action changes nothing. But action, even small action, creates results. The men in my practice who see the fastest improvement are the ones who implement immediately. They don't wait for perfect conditions. They start where they are. If this information helped you, subscribe to this channel for more videos like this. I cover prostate health, erectile function, and men's urological issues every week. Practical protocols that work, not fluff. One important note. This video provides educational information based on medical research and my clinical experience, but it does not replace personalized medical advice. If you're experiencing persistent urinary symptoms, pelvic pain, or erectile difficulties, consult with your physician or urologist. They can evaluate your specific situation and create a treatment plan tailored to your needs. Your prostate health is within your control. Take that first step today.